Hello, everybody. Good afternoon. My name is Corina Sabicu. I usually host the Indigenous health topics discussions, but this afternoon, my colleague down in Arizona, Trudy, will be hosting our guest speaker. She is there in person, but before I hand it off to her, I just want to go over some housekeeping items. So we will have time today at the end of our presentation for Q&A. So if you do have any questions throughout the discussion, please drop your questions in our Q&A chat box, and my colleague Guthrie will be going through those at the end of the session. And with that, I'm going to go ahead and hand it off to Trudy, who can introduce our guest speaker today.
Hello, everyone. Trudy Jackson, Hello, everyone. I am Trudy Jackson. I am the Community Engagement Coordinator based out at the Mayo Clinic at the Phoenix campus. And my role is primarily working with the urban Native organizations within the catchment area of Maricopa County, as well as building relationships with the sovereign nations. There are 22 federally recognized tribes in the state of Arizona. So with that, I want to introduce our presenter, Dr. Kimberly Yellow Robe. Dr. Kimberly Yellow Robe is a very well-respected individual in the Phoenix community. I had the opportunity to meet her when she was working for Social Security Administration, and some of the fascinating webinars and presentations that she did specifically for Native Americans was very informative from the different protocols within Social Security, over from filing a claim and applying for Social Security and retirement and everything like that. Now she's with Banner Health University, and I will turn that over to Dr. Kimberly Yellow Robe.
Pinhini Weste, Lilampito King Weste, Kimberly Yellow Robe Machia P, Ma Sikaji Lokotoyate. Good afternoon. I said today is a very good day, and thank you all for joining us on today's presentation hosted by the Mayo Clinic. My name is Kimberly Yellow Robe, and I am an enrolled member of the Rosebud Sioux tribe from South Dakota. Our tribe's name is, official name is the Sichangu Lokotoyate, which is the burnt thigh people. I'm going to present information today around cultural perspectives and focusing on American Indians and disabilities. And I made my PowerPoint, I do see a lot of folks wanting to decolonize and change things and, really focus back on our tribal communities, our heritage, our culture, our history. That is what keeps us resilient. And that is really important to us when we consider disabilities in Indian country and how our indigenous determinants of health are very different than mainstream society. So I'm going to go ahead and try to push. Oh, there we go. So these are the social determinants of health. We're looking at neighborhood and the built environment around them, our health and healthcare, social and community context, education, economic stability. So if you take a look at these through a Native lens and then think about how these apply in mainstream society, we have very different challenges, barriers, and access to healthcare. We have challenges to housing. We have challenges to education. And we also have some of the challenges that we have were magnified because of what was happening with the COVID the past couple of years. So really wanted to emphasize from a tribal lens what these look like and how American Indians with disabilities see these. I'm going to start the presentation off. I did a little bit of history check-in, and I posted some of the tribal flags here from Arizona. And I want you to take a look at each one of these tribal flags and think about it. What do you see? There's history represented on each of these tribal flags that reflect the tribal communities that the land that surrounds them. I should have put my tribal flag on there because I know my tribal flag story a little bit more, but I wanted to use these images of the flags to share with you how important our history, our land, our culture. You look at the Gila River Indian community, you look at the cactus, you look at the mountains, you see the land, you see the water. Other flags, you see the agriculture, you see things thrive from the community because of the water that surrounds them. So historically speaking, our history is very important that we reflect on it and ensure that the needs for individuals with disabilities are met, even though through the passing of time, things have changed. So if you're tribal, look at your own tribal flag and think about what you see and think about how differences and things changing time moving forward, how things have changed with our land, with the services that our people need, with the culture. So you can see these on these representing, you see the White Mountain Apache flag. There's timber, there's water, blue skies. I'm going to start this session, a presentation off. I wanted to make share my appreciation for some of the contributors to a summit that I've been working with for the past 20 years. And in the spring of 2024, we will be hosting our 20th annual American Indian Disability Summit. And throughout these 20 past years, we've had incredible speakers share their stories. We have incredible speakers and programs, collaborations that have come and shared information, resources, housing, healthcare. We'll be having our 20th summit next year. So I wanted to send my appreciation out there to my colleague, Dr. Daryl Joseph, for keynoting not just the Disability Summit, but we also will be having our 4th annual Tribal Youth Disability Summit next year too. And Mr. Joseph, Dr. Joseph, excuse me, has contributed through presentations and through sharing information around disability. So I wanted to send that appreciation to my colleague, Dr. Joseph, and I'll go ahead and start this. Yes, it does.
Perfect.
He wants you to share the video link for the second one. But it's in the PowerPoint. Okay, here's the next video right here. We'll just go into Hongbi's song. And this was again shared by my colleague, Dr. Daryl Joseph over from NAU. Do we go ahead and push play?
Let's. Can we all hear and see?
Yes, it's good.
Net Hongwei Yamasewa, Net Systemovi Akita, Net Dowowa, Net Sura, Sis DJAP, Aaron Preston. I'm the KYI Sound Volunteer. Please help us donate online Arizona Gifts Day. Your money will help us to stay on air. Kakona mahalate. And thank you for your support. So kakona mahalate wa nawakani. So thanks and have a great day.
Hongbi had many medical problems: sight, balance, hearing, speech, heart, and fine motor challenges, which was very painful to hear as a newborn comes into this life that is your child. Hongbi visited a lot of hospitals, clinics, doctors, and experts for his hearing, eyesight, speech, balance, fine motor skills, and his heart problem. Hongbi had to have heart surgery on his heart when he was just a baby. We went to a lot of workshops to learn about Down syndrome. These were very hard times where nothing was uplifting. The doctors and experts told me that he probably will not ever be able to do normal things like ride a bike or run. They said his hearing or eyesight will not be good and that he will never have good fine motor skills. But today Hongbi has a mountain bike he rides daily. He started with training wheels and wore his training wheels out so much that he didn't realize he was riding his bike on his own. He loves art. He draws with fine felt pen markers. He makes beads and loves to sing and record Hopi songs. He owns his own tape recorder and drum. Hongbi enjoys all the Hopi ceremonies and participates in all the ceremonies and community events. He runs daily for 2 miles and he joins the 100-mile club every year and accomplished his 100 miles for over 4 years. Hongbi doesn't have to check with specialists anymore. He had an appointment on March 17th and the report was good. The doctors said to keep it up and keep on running. I always look at him as normal. I never thought of him as different. I treat him the same way you would any other human being. Hungry wants to learn to read. There is no facility out here to help him to do that. I hope that as his father, he will continue to want to learn how to read more. My hope is that the Hopi tribal government will have a facility to support individuals with disabilities to learn more and be independent, because as Hopi, we never push our children aside, and I also hope that the government policies and laws will respect our Hopi way of life and enable us to work with Hopi people. As Hopi, that is our responsibility to always take care of them. That is my role as Hungry's father.
All right. Guess we're done right there.
So I wanted to start off the presentation sharing the stories of Ivy and Hongbi. A lot of deep connection to the community, to their surroundings, to just the accessibility challenge. I wanted to highlight that because those are very important factors for individuals with disabilities, and those challenges and barriers that are there, they're not always easily to overcome. It's going to take much more policies and changes to help our individuals out there living on reservation lands to get the services that they need without having to leave their tribal communities, and sometimes disconnecting or becoming displaced really does have an impact on us as American Indians living off reservation, new to the environment. It also does create somewhat of a culture shock. Uh-oh. I can't get the PowerPoint. There you go. I wanted to highlight this too, the 1948 signing of the Garrison Dam Agreement. You can see the tribal leader there in tears crying throughout the signing of that agreement. It meant a lot of different things to the tribal leader, knowing that their water was going to be taken. And, throughout different tribal histories, this has happened. We have tribes that have had an abundance of agriculture, farming districts, lands with water, abundance of water. And when the waters got dammed upstream, it really disconnected and impacted negative way the land and the community. So our traditional diets were impacted. Without the water, the land became dry. There was no way to get water to maintain the farmlands and the agriculture that was there, and so much indigenous to our communities, where when these changes happened through these agreements, it impacted our traditional diets. So we didn't have anything much that we could do with that impact besides becoming sick and really getting disconnected from the traditional foods that kept our health balanced and whole. I wanted to mention traditional practices and maternal mortality. This source is from the National Indian Health Board, and we're seeing through the Indian Health Board's studies how maternal mortality is high up there for American Indian women. One thing that keeps going a common discussion is traditional practices during pregnancy. And, listening to American Indians with disabilities, sometimes they may feel that we didn't participate in some of those traditional practices, which is what led to their becoming disabled. Some of the traditional practices that I participated in when I was pregnant 4 times was working with my healthcare provider and my obstetrician, and letting him and his team know what was important to me. And what was important to me helped maintain my pregnancy and keep it healthy and keep it focused. I knew that once I had my children, I would want to keep their placentas and have them buried out on the reservation where their fathers and their grandmothers and their great grandmothers and their uncles' placentas were buried. Although I am Rosebud Sioux, my children's father, they're half Navajo, so I call them Sujos, but their placentas are buried out on the reservation, and I felt very balanced and very whole in doing that, because that is something that we would have done too as a traditional practice coming from the Lakota side as well as the Navajo side of my children. So really want to maintain these traditional practices and continue them on, because some folks really do depend on these practices to be recognized and honored. The COVID really had a deep impact on our tribal communities. You know, when we're looking at some of our determinants of health, we're also looking at, you know, where we pray. And as for American Indians, you know, we don't necessarily have to go to any physical churches, any meccas, any structure buildings. You know, we can pray right where we're sitting. We can pray when we're in class. You can be praying when you're working. So we don't really have to have those places to congregate. We do that out on our reservations through ceremony. And when the COVID impacted our communities, you know, we didn't know what was happening with this pandemic, you know, all of the isolation and quarantine. And it did create behavioral health, mental health issues for folks on our reservation lands, both on and off. But we did see an uptick in suicide, and especially amongst the youth. So when we were able to start coming back together and coming together for ceremony, you know, for us as Lakota, we have 7 sacred ceremonies, and one of them is the Sundance. You know, we honor our culture, our spiritual practice. And this is a flyer that was shared, that was sent recognizing the Sundance for 2021. And when I received the flyer, I was just very devastated to see and to know and to hear that my relatives, many which have disabilities, were impacted. They were vulnerable with the COVID, as well as some of them had behavioral mental health crisis, which led to their suicides. So did have relatives that did suicide, and then relatives that had disabilities that were taken from us because of the COVID, and they couldn't fight back the COVID. The COVID was just too powerful for them. So for our Sundance, we honored those that had passed and honored them through memorial Sundance and memorial service here. So I wanted to share this with you because spirituality really is important to us. It keeps us anchored. And when we had that disconnect because of the COVID, you know, somewhat stalling our ceremonial practices, it did cause hardship for many of our community members out there with disabilities, not having access to transportation, not having access to healthcare. We see healthcare out there in Indian country is really challenged. You know, we continually hear how underfunded Indian Health Services, if that's where we receive our services, or if we don't live on the reservation, we live in the city, we may not know how to navigate the healthcare system. So we do have disparities out there. And for individuals that have disabilities, it is a challenge to navigate the healthcare system when trying to access services to help address and navigate the disabling condition that we're dealing with, that we're trying to manage. So really wanted to emphasize on healthcare is a challenge for us as American Indians if we're using the IHS system. And we also find that, you know, for disabilities, you know, you may go to a mainstream hospital and receive the services that you need at a one-stop shop. But if you're using the traditional IHS system, the IHS system, you may not have those services when you need them. You may have to get referred out for them. And then again, when we hear, I'm part of the Intertribal Disability Advocacy Council, and we hosted listening sessions. And a lot of the comments that came from the listening sessions was transportation. So we're challenged without having transportation. So when we have to get reassigned a primary care provider, or if we need to go to specialty services, podiatry, even eyes, heart, you know, it's a challenge getting there. So we really do want to take note to identifying some of the challenges besides transportation. We're looking at housing, you know, for individuals with disabilities living out there on tribal lands. It's important to know that the ADA doesn't necessarily apply to all of Indian country. When I was studying for my doctorate program, I actually did look into see how many tribes have specific ADA ordinances written into their tribal ordinance, and there's about 13. One of the larger tribes, the Navajo Nation, does have that ordinance written for its individuals with disabilities into their tribal ordinance. So they do have laws and policies that pertain to protecting individuals with disabilities out there, but not all tribes do. My tribe does not. I understand that the Pine Ridge, the Ogallala tribe also has the ADA written into their tribal ordinance as well. So you can go into some of the most finest tribal resorts and not have access, you know, the little automatic doors. You can push that button to make the door open. It's not always going to be there. You know, I've traveled across Indian country and have witnessed and have experienced, you know, some of the really nice resorts that don't have access. They may not have, the hotel rooms may not have that accessibility as well. So those type of things really do have an impact. Not having rules, policy, or regulations to help protect our individuals with disabilities is very important to take note of. Does anyone have any questions? This is my grandfather. To the left, his name is Chauncey Yellow Robe. I come from a family of 4 chiefs. My grandfather here, his grandmother was Chief Sitting Bull's sister. So come from a long line of hereditary chiefs. So this is my grandfather when he was sent off to Carlisle. The after picture, the before picture is him in his traditional regalia with others that are being sent off to Carlisle. So this is my before and after, focusing on my grandfather and my ancestors. I want to thank you all for your time and for listening, and I really do want to apologize for the technical glitches that we had, and appreciate the team here, the Mayo team here, for hosting the event today. I don't see any questions in the chat, and I'm going to turn it back to Trudy. Wopilas.
Hi, everyone. Stop sharing.
It looks like we have a hand raised by somebody. Let's see.
Any questions?
I don't see the hand raising.
For the individual who raised their hand, go ahead and raise your hand again, and I will get you permission to unmute. Oh, we got one question in the chat there. What can be done to increase the awareness of IDOH for individuals with disabilities?
Advocacy. Teaching individuals with disabilities to become their own advocate, firstly. And once we know how to advocate for ourselves, we can better inform others of what those determinants of health are and what they mean to us as well. Advocacy and effective policy making. Another great avenue would be to empower our tribal youth with disabilities and helping them to understand at what a young age they can become advocates and create and make change for policy that will have an impact not just for them today, but for the rest of the ones coming up after them. So advocacy is very important in understanding that it's not wrong to have a disability. Disabling conditions happen. And according to federal statistic from the Social Security Administration, we see that American Indians 20 years ago, our life expectancy, according to those statistics, we were going to be, for American Indians, life expectancy was 56, and for women, it was 62. That was 21 years ago. And you look at the statistics today, because of modern medicine, we're living longer. So once we start understanding the need for, firstly, taking better care of ourselves and our condition and doing what we need to be doing medically to address them, advocacy is very important. Thank you, Dr. Joseph.
All right, it looks like we have another question in our Q&A. So the question is, what tribal disability resources are recommended for adults, youth, and children?
A lot of the urban Indian programs have some great programs there that help remind us that we have that cultural anchor there and supports in place. There's also tribal programs out there through the tribes that have wellness programs that address needs, special needs, disabilities, providing resources, identifying resources. There's also national organizations that have that serve as umbrellas addressing disabilities and creating resources and toolkits for them. One organization, the National Indian Council on Aging, just finished revising its Tribal Disability Toolkit, and it's about 217 pages long. And it really is a great toolkit that has independent living resources, transportation, housing, education, employment, several different subjects identified in the toolkit that have resources, current resources available, including websites that individuals can access. So being resourceful is very important. But once you start identifying those resources, they'll start falling into place. There's quite a few out there. They're there. It's just sometimes we have difficulty navigating to get to them. Thank you.
Right, there are a few other comments and questions in our chat. One of the comments is from Kayleen. She said, "Thank you for sharing." A comment is, our Hopi's Women's Health Program is currently working with a university project utilizing patient navigators to provide guidance for patients living with disabilities. And then she also posted a link in our chat. So here's the project website for cancer screening navigation for patients living with disabilities. Thank you for sharing that resource, Keeling. And it looks like another question. So what types of programs are being facilitated to encourage natives who may be displaced, who are not living in their ancestral homelands?
I see us here living in the urban setting. I moved here to the city in August of 2000, coming from a reservation. And I absolutely said I will never become an urban Indian, and now I'm an urban Indian, but not really. I consider myself a metropolitan Indian. I participate in talking circles. I facilitate them, I host them, just as other programs facilitate and host talking circles. And it really does bring that grassroots voice out. And we were able to reconnect, although we live here in the city. It does have that village concept here, know a lot of Lakotas, just coming together, networks, wellness events, community events. Just being involved in the community is really important too, to help keep us anchored with our culture, and just finding really great people to lean on. Thank you.
Right, and another question. So what are the differences between how Native communities view disability than the Western culture and how we value people?
Yeah, that has come up a lot. I've worked with disabilities since I graduated from college back in the late 1900s, say. I've worked with disabilities, American Indians that were resided in nursing homes. And back in the mid 80s, these folks were coming from traditional communities. They were traditional folks and still practice. And back then, our grandmothers were continued to wear their traditional dresses and skirts and clothing. So they still, what I'm getting to is still having that traditional way of thinking, Indian way of thinking. I don't know how to put that, but when I was working with them, they always kind of went back to saying, why am I like this? They may have traumatic brain injury from an automobile accident. They may have become involved in accidents, where they became disabled, or they may have become disabled because of a health condition, where they had a stroke or they had aneurysm. But one thing that kept going back was maybe it was something that my mom did when she was pregnant, or maybe it was something that she didn't do when I was in her stomach, or maybe she's seen an animal. For us as Lakota, it's seeing an owl or hearing an owl. Not a good thing for us to experience or to have happen around us. So having them understand that disabilities happen. You were involved in a car accident, you had a stroke, or going back to that condition and helping them to understand how they can help themselves in understanding what their condition is, what does it mean to them, and what resources do we need to provide you, to get you in a zone of balance, where you're feeling a little bit better, as they continue to navigate their healthcare. So it really is a matter of education, maybe not coming from the books. The education would come from the heart, help them to understand, hold their hand, show compassion, empathy, consideration. And again, the individual with the disabling condition, whether it's seen or unseen, we have physical conditions and we have unseen conditions, just unseen that you can't see, internal. So we want to help them understand what's going on and get the resources that they can benefit from.
Still waiting for a few more questions to come in. Certainly appreciate your responses here as well as the presentation. It's good to see Lakota in Phoenix. Yeah, I'm Hunkpapa over in Rochester at the main Mayo Clinic site.
Well, I wore my traditional Elks teeth dress today. I wore my traditional Elks teeth dress today, and I have my belts and my drag right here. And if you were here in person, I'd give you a hug. I wear the belt, and my Elks teeth dress has about, I don't know, about 180 Elks teeth on them. My belt is my concho belt. So this concho belt here has its own story, and so does the drag right here. So back in the, I always say back in Tipi days, Ihane days, the Sichangu, my tribe, the Burnt Thigh people, we used to linger around the base of the Black Hills. And when the folks, the foreigners started coming into the Black Hills and taking out the gold, we sat around the Black Hills, and sitting around the Black Hills, they used to chunk pieces of gold at us, and we never knew the value of what Mazaska money is. So we would take those chunks of gold and hammer them into our belt. And then this side drag right here, too, part of our money belt. But this side, this right here honors my ancestors that were killed and murdered by those that carried the saber. So I memorialized my ancestors on my dress, and there's other things on my dress, like these right here. These buttons are shells, and they represent Mazaska money. And like I said before, my grandmother said that we may be Mazaska poor, we may not have a lot of money, but we are very rich in culture. Wopila, thank you.
Unmasha Shni, huh? Like that.
Thank
Yeah.
you.
Wash day.
Leila and Peter Kinwash Day. Today is a very good day. And it also rained here in Phoenix. So had that beautiful morning smell of rain, waking up to knowing that we'd be coming together to share information from a good Lakota Shante, from a good Lakota heart. And I was gonna say, when I was coming, I had to walk past the light rail here, and lady came up to me and said, "You're an Indian." I was like, "Oh my gosh, I am." I took a picture with her, so you'll see me on a postcard somewhere. Hey, I want to thank the Mayo team for putting this together, and I understand you had some other great speakers present on your series, so I actually was able to see. So thank you, Trudy. Trudy's over here. She's hosting some people here, but we're having a great time over here at the Southwest Center, and it's great to be hosted. So here's my colleague, Trudy, and she'll be taking it over from here.
Thank you, Dr. Yellow Robe. That was a really great conversation, and also for describing the outfit that you're wearing today and what it represents in within your tribe. So thank you for also sharing that. It's always nice to see our different tribal representations and what our different jewelry and regalia or outfits mean. So thank you for that. And I'm just going to share my screen really quick before Trudy.
Let me stop sharing mine. No, I think I'm done sharing mine. Okay.
All right, so I will be dropping in the chat our survey. If you all could take our quick survey to provide feedback on our speaker series, that would be really awesome if you could do that. Also, if you are interested in seeing any of our previous speakers, we do have them posted on our external Mayo Clinic website. So here's the link as well. And let's see, the survey is here. We possibly may have an upcoming speaker in December, but that's pending at the moment. If not, we will be restarting our speaker series in the new year, and we'll look forward to seeing everybody at that time. And I just want to thank you again and let Trudy just close us out there in Arizona.
All right. So just want to extend our appreciation from Phoenix for everyone attending virtually. And we look forward to hosting another one in 2024 and looking at including individuals from rural tribal communities as well. So just like I said earlier, there are 22 federally recognized tribes in the state of Arizona, and Phoenix is an intertribal community. So therefore, we'll bring in more speakers as well. So with that, and thank you, and I'll have a great day.